This research explores the complexities of diagnosing and monitoring pancreatitis, a prevalent disorder affecting the exocrine pancreas in our canine companions. Despite being a common ailment, reaching a definitive diagnosis of pancreatitis in dogs remains a considerable challenge for veterinary practitioners. Historically, histopathology, the microscopic examination of tissue samples, was considered the gold standard for diagnosing this condition. However, the nature of pancreatitis, often involving localized areas of inflammation that can be easily missed during biopsy, coupled with the invasive nature of obtaining these samples, means that this method is no longer routinely employed. In contemporary veterinary medicine, a best practice approach to diagnosing pancreatitis typically involves a comprehensive evaluation of a dog's medical history, findings from a thorough physical examination, the concentrations of specific serum biomarkers, and the findings from abdominal ultrasonography. Among the serum biomarkers frequently assessed are pancreatic lipase concentration, often measured as canine pancreatic lipase immunoreactivity, and the concentration of C-reactive protein. Canine pancreatic lipase immunoreactivity is recognized as a highly sensitive and specific indicator for the diagnosis of acute pancreatitis. However, its diagnostic sensitivity appears to be reduced in cases of chronic pancreatitis. On the other hand, C-reactive protein is a biomarker that reflects systemic inflammation, and its levels are known to increase in dogs experiencing acute pancreatitis. While this clinical diagnostic approach offers substantial advantages over relying solely on histopathology, it is not without its limitations. One notable challenge is the frequent occurrence of discrepancies between the results obtained from different diagnostic tests. Furthermore, the sensitivity of serum biomarkers can be lower in chronic cases of pancreatitis. It's also important to note that elevated serum canine pancreatic lipase immunoreactivity levels can sometimes be observed in situations where pancreatitis is not the primary disease process, suggesting a secondary involvement of the pancreas. Researchers have observed diagnostic discrepancies between ultrasonographic findings of the pancreas and the results from both enzymatic and immunological lipase assays. Some studies have reported only a fair level of agreement between enzymatic lipase activity and pancreatic ultrasonographic findings, while others have documented a weak correlation between canine pancreatic lipase immunoreactivity concentrations and pancreatic ultrasonographic findings in dogs. This study highlights the complex interplay between clinical signs, biochemical markers, and ultrasonographic findings in dogs with suspected pancreatitis. It emphasizes that the resolution of ultrasonographic abnormalities may lag behind the improvement in clinical signs and the decrease in pancreatic lipase and C-reactive protein levels, particularly in cases of acute pancreatitis with initially high specific pancreatic lipase concentrations.